Hello, how are you?
I'm good. How are you today? Hello, hello.
Wonderful, wonderful. So, Dr. Candice.
Yes, that's me.
All right, so I'm doing my official opening. Thank you so much for joining us.
Thanks for
I
having me.
am Rose Pettigrew, just so that you know. All right, so I introduced the fact that we are talking about this COVID-19 vaccine
Hmm.
to prayerfully empower everyone to make informed decisions. Okay, so
Indeed.
COVID-19, as we all know, has disproportionately impacted communities of color for a number of reasons. It is the people that look like us that are the essential workers that are working hard to hold the line for many of the days that we have. And we want and need our fellow Chicagoans and Northwest Indiana people to stay safe. Okay, so now that we have vaccines available, it is really important that we understand the facts and operate from a baseline of truth and not the many falsehoods that seem to run rampant in our circles of friends and family. I can attest to that. I have people telling me every day, all the time. So today we have a special guest that's going to be with us the entire time so that we can really get into the ins and outs of the latest information on COVID-19 and of course the vaccine. So let's welcome the beautiful Dr. Candice Robinson, who is the medical director with the Chicago Department of Public Health. Welcome.
Thank you.
Thank
Good
you
to
so
be
much.
here.
So Dr. Robinson, I know we have the daily briefings on COVID-19, but sometimes it can all seem like it's just overwhelming with the numbers. Can you give us, in layman's terms, a perspective on how things are really going in the city of Chicago?
Yeah, so I think the good news is we're actually seeing our cases go down in the city of Chicago, and we're seeing what we call our percent positivity for COVID go down. And what that is that just the percentage of people who tested positive for COVID out of everyone who has tested positive for COVID. So we are headed in the right direction, and that's good news. But I think it's also important to remember that that doesn't mean we can let our guards down. We must remain vigilant. We must continue to protect ourselves. We must continue wearing our masks, washing our hands, social distancing, avoiding crowds. We must continue to do all of those things so that we can continue to head in the right direction.
So I noticed that, once they closed down restaurants and other businesses where people gather, the numbers, of course, they tended to go down. Now they're talking about reopening these particular businesses. Is that going to affect the numbers and in terms of them going up?
Yeah, so we'll be watching the data as we do, every time as we improve, we see, how we can expand and what we can do to open up. And then we watch the data and see what our next best steps are. And so every, action that will be happening in Chicago will be informed by the data and informed by what's actually happening right now.
Okay, great. Now, can you give us the 411 on the vaccines and how they actually work?
Yeah, so right now we have two different vaccines that are currently authorized for use. It's the Pfizer vaccine and the Moderna vaccine. So you might have heard both of those names kind of thrown around. Both of these vaccines are what we call mRNA vaccines or messenger RNA vaccines. And what that means and how they work is essentially they teach our body, they contain kind of instructions that teach our body how to make a harmless protein, harmless part of that COVID-19 so that our bodies can recognize it and defeat it the next time they see it. So if you've ever seen a picture of COVID, it's like that ball with all those spikes hanging and sticking around.
Right.
Those spikes are called the spike proteins. And those are really important to the virus because that's what helps the virus get into our cells and helps the virus make us sick. And so what that vaccine is doing is teaching our bodies to identify that piece so it can defeat it the next time it sees it, and then, so the virus can't infect us.
All right. And so, we're hearing a lot about it being a two-dose regimen.
Mm-hmm.
So why is that second dose so important? And a lot of people think they don't even need to take that second dose.
Right. Yeah. No, sometimes we think, oh, we got one dose, we're good. But that second dose is really important so that that vaccine can kind of give you the most protection that vaccine to give you. So I'll put some numbers with it. For example, in the clinical trials, the Pfizer vaccine was around 52% effective after the first dose of the vaccine. But when participants got that second dose, it was 95% effective in preventing COVID. So that second dose is really important so that you can get the most protection that you can get from that vaccine.
Okay, so again, don't think that you're okay with just that one dose. You need added protection with this double dose. So as you know, we've been working with the Protect Chicago team to help spread the word about getting to the truth about the vaccine. Now, there's a lot of misinformation that leads to vaccine hesitancy, especially for communities of color. We want you to help us clear up some of those myths.
Right.
So one of the myths is, I can't trust the COVID-19 vaccine because it was created in a rush.
Yeah, so I hear that one a lot. You know, how do I trust this vaccine? It came out so fast. How did it come out so fast? So I think a couple of things are important to know. So first, while this is one of the first vaccines that using this mRNA technology, this technology has actually been under study for more than a decade. So this technology is not new. It's not something that just came up. Scientists have been studying this for a while. And I think it's also important to note that all of the steps of the clinical trials were still done for these vaccines. So they went through all the phases of the clinical trials, and those clinical trials showed that they were effective and safe. So those are two very important points, that this is not brand new technology, and it did complete the clinical trials.
All right, here's another myth. The vaccine will give me COVID-19.
Yeah, false. So the vaccine does not contain the live virus. It does not contain the dead virus. It cannot make the virus. The vaccine cannot give you COVID-19.
All right. I've already had COVID-19. I don't need a vaccine.
Hear that one too. So what we do know is that it is possible to be reinfected with COVID. So just because you've had it once doesn't mean you can't get it again. And so even those who have had COVID in the past are still recommended to get the vaccine.
Okay. Now, COVID-19 survival rate is pretty high. I don't need a vaccine to be protected.
Yeah, we've also heard, I eat right, I'm healthy, I don't have underlying conditions, right? Everybody thinks, that way I don't need the vaccine because I'm healthy. I don't need it. But I think it's important to note that even healthy people, even people with no underlying conditions, even people who exercise and eat right can get COVID-19. And it's also important to know that while, many people get COVID-19 and they recover, there are still people who have longer term complications. And, you can also still have serious disease or worse in the hospital or worse from COVID, even if you're healthy, even if, you do all the right things. And so you never know how COVID is going to impact you. And that's what's important to know.
Okay. Now, this is one I have to admit, I was saying this. It's better to wait to be vaccinated. Once more people have been given the shot, then I'll see about taking it. Talk to us about that.
So I think, here's what I always say to that. I hear that a lot. I want to wait and see. I want to wait and see. Well, waiting and seeing, every time you delay that vaccine, so if you're eligible, if you're delaying getting vaccinated, you're delaying that protection that you could get from that vaccine. So that's important to know. Now, we'll note, we have different phases of vaccination, so not everybody is recommended to get it all at the same time. There are different phases and different people who are recommended at different times. But what's important is that everyone gets the information that they need so that when it's their turn and when it's their time, they feel confident making themselves.
Okay, great. All right, here's another one. We don't know what's in this vaccine.
Yeah, so this vaccine contains that mRNA that I was talking about. Those are those instructions that go in and teach our cells how to make that protein so we can defeat it. And it's important to note that those instructions, after they do their job, they go away. I think about it like a good spy movie. After those instructions are read, they are destroyed by our cells and they don't stick around. They don't hang around. So that's important to know. And then that mRNA is actually encased in a little bit of fat. Some fats are in the vaccine. That just helps to protect it until it gets inside and starts to do what we need it to do. And that's just suspended in a solution. So there's no, heavy metals or anything like that in the vaccine. That's what it contains.
Okay. After getting a COVID-19 vaccine, I will test positive for COVID-19 on a viral test.
Yeah, also not true. So that COVID-19 vaccine will not make you test positive on a viral test. So if you have a positive viral test, it is not from the vaccine.
Okay. And then COVID-19 vaccine will alter my DNA. That has been going around a lot.
Yeah, I've heard that one, and that's also not true. So your DNA is housed in the center of your cell in this little area called the nucleus. It's housed there. It's kind of walled off in a case by itself, and that mRNA doesn't go in there, doesn't go anywhere near there. And it's also important to note, like I said, that once those instructions are used and the cell has kind of, gotten everything it needs to get out of it, those instructions are destroyed. So they don't hang around, they don't float around, etc. And so it doesn't interact with your DNA at all. And then once that vaccine is done, it is actually destroyed by your cell.
Okay. Here's another one. I only need to get one COVID-19 vaccine dosage. We already discussed that. That is not the truth.
That is not the truth. And you need doses for this virus.
Now, I was hearing on the news earlier today that other companies are gearing up to release their vaccine. How are we looking with that? Or are we even debating that right now? What?
Yeah, so there are other vaccines that are in different stages of study and some nearing the end of their studies. And they may also go to the FDA soon to seek, the approval for those vaccines to be used. So there are a couple of other vaccines coming down the pipeline. People may have heard of Johnson & Johnson has one, AstraZeneca has one that are still under study and may be coming to the end of their study period soon. So we'll have to wait and see what happens here over the next couple of months. They will face a similar process. After they get done with their studies, they'll have to submit an application to the FDA, and then it will have to kind of go through all of the FDA discussion, all of the evaluation, just like these first two vaccines did. And so we'll have to see what comes out, but I do anticipate we'll hear more about this in the next couple of months.
Right. And then, Dr. Robinson, what about for the people who are intent on taking the vaccine, but they're having difficulty getting appointments and all of that? Is it available to everyone who wants to get the vaccine?
Yeah, so right now our vaccine supply is very limited. So as a city, we just moved into what is called phase 1B. And that is means that anybody 65 and older is recommended for vaccination, as well as some frontline essential workers. So that includes our first responders, our teachers and daycare staff, our postal service workers, grocery store workers, a few other categories are included in there. But right now our vaccine supply is very limited. And so there are far more people who want the vaccine than we have vaccine available right now. So we're really urging everybody to be patient. This will take us several weeks to get through this 1B group. And if you want to see who's all in that 1B group, we encourage you to visit the Chicago Department of Public Health website. It's chicago.gov/COVIDVAX, COVIDVAX. But yes, it will be, a limited supply for now. So we just urge patience for everyone.
Okay. And now you mentioned 1B. There's also 1A and 1C.
Yes.
The alphabet plus one.
Right.
So, about the 1C and 1A, what does that mean?
Yeah, so 1A, that's where we started with vaccination. And we started that back in mid-December. 1A was where healthcare workers and residents in long-term care facilities were recommended to be vaccinated. So that's everybody working in our clinics, in our hospitals, et cetera, as well as, our elderly and I'll say seasoned relatives and friends who live in the nursing homes and assisted living facilities. They were recommended to receive vaccination. As of Monday, we entered what is called phase 1B here in Chicago. And that includes the persons over 65 and those frontline essential workers, as I mentioned earlier. And then next will be phase 1C. And for phase 1C, persons recommended to be vaccinated will be anybody 16 through 64 that have certain underlying medical conditions, and other essential workers. So kind of everybody else who's an essential worker will also be included in 1C. And then after that, we'll go into phase 2, which is anybody who wants a vaccine, 16 and up, will be able to be vaccinated.
Okay. And then just clarify for us once before we leave, with this vaccine not having the actual live virus in it, how does it protect us and exactly what does it do once we get the vaccine?
Yeah, so it protects us by, so like I said, it kind of goes in and it goes into our cells, those little instructions, that mRNA, and it teaches our cells how to make that protein, that spike protein, that protein that you see in all the pictures sticking around off of the virus. And what that allows our immune system to do is look at that and say, hey, that's not supposed to be here. The immune system gets to study it and learn how to defeat it. So that way, the next time, if you ever encounter COVID and that COVID virus has that protein on the top, your immune system will say, hey, I remember that. That's not supposed to be here. And it will know what it is and know how to defeat it when it sees it again. And that's exactly how it works.
Okay. And so this will help us with the recovery time and help us to not necessarily die from the virus.
Yeah, so it can help in a couple of ways. It can protect you from getting it, but there's also some preliminary evidence or preliminary studies that have shown it may also, even if you do get it after you get the vaccine, it may decrease the severity of disease. So we're learning a lot more, but really that vaccine is providing you the most protection that it can against COVID-19.
Wonderful. All right. All right. So, well, this has been a great discussion, Dr. Robinson. The truth is we all have to do our part to protect ourselves, our family, and our cities. So the first line of defense is to educate ourselves on the facts, which we just did today. So we're asking everyone will check out the website for more information. Can you give that website out again?
Yeah, absolutely. The website is chicago.gov/COVIDVAX, COVIDVAX. And you'll find the answers to these concerns that we addressed today, frequently asked questions, and much more information about vaccine rollout here in Chicago.
Wonderful. Dr. Candice Robinson, Medical Director for the Chicago Department of Public Health. Thank you so much for joining us here on Rejoice 102.3 and sharing this wonderful information with our listeners. And I pray that you guys are now informed, empowered, and you can go out and make the right decisions for you and your families.
Thank you.
All right. Have a wonderful day.
You too.
Thank you.
Bye.
Bye-bye. All right, guys. So you heard it here on Rejoice in the Afternoon with Deb and Norris. We were talking about the facts when it comes to getting vaccinated for the COVID-19 virus. And, now that we've talked about the myths, Dr. Robinson dispelled every single one of them. And now it's up to you to make sure you do what's best to get protected for you and your family. All right, well, you can tune in to Rejoice in the Afternoon with Deb and Norris right now. I am still on the air. Thank you guys so much for tuning in on IG Live for this important information. And we will be coming to you with more things like this as the days go on. All right, love you guys. I am on Rejoice 102.3 FM. You can listen live at rejoice102.com. Or you can listen the old-fashioned way on the radio. And you can also listen in HD. Go to our sister station, 92.3 FM, Power 92, and click on Channel 2. And voila, Rejoice will pop up on your stereo. All right, I love you guys. I am Deborah Rhodes Pettigrew. Bye. If I can turn it up.